I'm Dr. Ben Talei. I'm a facial plastic surgeon in Beverly Hills, and I wanted to go over something called aftercare. The basic concept of aftercare is you go to a hospital and you get surgery. Surgery can be done where they want to keep you inpatient or where they want to send you home as an outpatient. That means you leave the hospital. Inpatient surgeries are not as common. Outpatient surgeries are the ones that you really see every day for people getting elective surgeries, surgeries they choose to get, not ones that they have to go get as an emergency. So a hip surgery, for example, could be considered an elective surgery, whereas an infection with an appendectomy or a brain surgery is not really the one that you choose to do. And those ones that you don't choose to do, where you have problems overall, they keep you in the hospital as an inpatient. Sometimes they send you afterwards to a nursing facility called a skilled nursing facility or a rehab center. The majority of patients, however, don't qualify for either of these, and they're simply sent home. Even if you go to a surgery center for plastic surgery, let's say, not all surgeons have a plan for afterwards. They usually send you home with some instructions. Some people even go home with a nurse to take care of them overnight. So there's this huge gap in aftercare in the medical world. And to fill that, there are either at-home nurses that go, or there's small facilities that have popped up over time here and there to take care of patients. This is really important because when you go home after even a tonsillectomy like I did, I really didn't know what to do. And I'm a doctor. So it was, I had to go through the instructions, figure out what to do for myself, take care of myself. And after a night, you figure it out. But that first night is usually a little anxiety provoking for people. And they prove to be a bit of a burden on their families sometimes because the families don't know how to take care of things either. So everybody's anxious. To fill this void, we as well have come and started working with an aftercare center here in Beverly Hills called Aura AfterCare. And the goal there is to take patients that could have gone home, so they're healthy enough to go home, but are scared to go home or need some help taking care of themselves, usually for a couple of nights. Some people even stay there for a week, but most people stay there for a night or two. They really kind of get the education they need from the nurses. They feel comfortable being taken care of, and then they go home. So they don't have to go home with their mother hanging over the bed like mine was, worrying about me, thinking, oh my God, are you going to be okay? When all I had was a tonsillectomy. And for me, it would have been nice, instead of going home, just to stay at a hotel and be taken care of and have people bring you the medicine you need and bring you the food and things like that. So I hope this idea will catch on more and more, because doctors like myself didn't use it. I wasn't using it for years, and I didn't think it was necessary. And I'd send my patients home saying, don't worry about it. I'm a perfect surgeon. I do perfect surgery. You're not going to have any problems. Just go home. And I really forgot about the rest of everything, which is just making people feel comfortable, especially that first couple of nights. So Aura Aftercare we have here. We hope this will pop up in other cities as well, so everybody has this option. And if doctors don't offer it to you, you can always reach out directly to these centers and ask them to call your doctor and have them bring you in.